Rock climbing automatically causes a lot of determination, which is something I think that makes it a little addicting. I do things that surprise myself because I'm under a lot of pressure. It's the same way with residencies. You put yourself under a lot of pressure, and all of a sudden you start proving to yourself that you can do it. One of the reasons I love climbing, one of the reasons I love this residency, is because it's a challenge, but it's super rewarding.
The number one mission of the residency is to train capable, excellent, quality doctors. But a really important piece of that puzzle as well is kind of helping you grow into the type of person and physician that you want to be too.
We're the only residency out here. So in the hospital, if there's a teaching moment to be had, they'll call on the residents, and it's just us that they call on. So that provides us with a lot of opportunities for learning.
Part of the reason I chose this residency was because I thought it would prepare me well for about anything. I remember interviewing here and talking to the current residents and hearing about former residents and kind of where they had gone, and they were doing a little bit of everything.
I think when you find a community that practices in similar ways as you, and a community that prioritizes things that you find fulfilling and things that you also want to prioritize, such as underserved medicine, rural health, kind of practicing full spectrum medicine. When you find that community, you want to be a part of it, and you'll do everything you can to join that.
So I was at a big family medicine conference where you get to interact with all of the different residencies. When walking up to the booth for this residency, you could tell that all of the individuals, the residents, the staff, were really happy. They didn't seem tired. They were really into just meeting all the medical students coming up and interacting with everybody.
What we found in medicine is that there is this imbalance between the needs of the jobs and both the needs of a person. We have really high rates of burnout in medicine. Here at St. Mary's, we're really focused on a type and quality of training that promotes physician-resident wellness as a whole. It is a huge choice to pursue medicine, and you commit a lot of your life to that training, and you want to be fulfilled in your job, and you want to find ways that you can use that to promote wellness in your community, but also ways to promote your own wellness, and I think that's something we do really well here.
Residency is not easy. It shouldn't be easy. It's not supposed to be. But it makes it a lot easier when you're enjoying yourself outside of work, so that when you come back in, you feel refreshed and ready to go and take good care of your patients.
Some of the first questions that they asked me when I showed up for my interview here was, so what do you like to do? And I would try and go and answer them medically in like an interview style. I'm like, no. What do you like to do outside of medicine? And that's when I started to realize, oh, these people have what I'm looking for. They have good life balance, because that is definitely something that I did not have in medical school.
Kind of surprising that a small town like this will have a peach festival, will have a wine festival, and we'll have people coming in for concerts. So there's just a lot of great opportunities out here.
I honestly can't imagine not coming here. I love Grand Junction. I don't plan on leaving. It's truly an amazing place.
Residency is a huge kind of swath of your life that you're committing to training, and a big piece of that is finding a place that you can call home.